Hello, my name is Chatushka Samradivakaran and today I'm going to do my presentation about nephrotic syndrome. This is my name and the date that I'm doing this presentation. And I'm using this slide as a flashcard. Nephrotic syndrome is characterized by massive proteinuria, lipiduria, hyperlipidemia, hypoalbuminemia with a generalized edema. Nephrotic syndrome is not a specific glomerular disease. It is because of an increase in glomerular permeability and the loss of plasma proteins in the urine. The increase in glomerular membrane permeability allows proteins to escape from the plasma to the glomerular filtrate. So it leads to a massive proteinuria and then to hypoalbuminemia. Generalized edema can result from the loss of colloidal osmotic pressure of the blood with subsequent accumulation of fluid in the interstitial tissues. There is also water and salt retention because of the stimulation of sympathetic nervous system, the increase in aldosterone, reduction in secretion of natriuretic factors, and it can aggravate the edema. Initially, the edema presents in lower extremities and it becomes more generalized when the disease progresses. Also, because of the pulmonary edema, pleural effusion, diaphragmatic compromise, the dyspnea can happen. The second one is the three syndromes from urinary system. The first one is acute renal failure syndrome. It is a sudden and sustained deterioration of the kidney function, and it can be characterized by the decreased glomerular filtration rate and the increased sodium creatinine and oliguria. It can result from decreased blood flow to the kidney, or the disorders that disrupts the structure of the kidney, or the disorders that disrupts or interferes with the elimination of urine from the kidney. The second one is the chronic renal failure syndrome. It is a condition in which the kidneys are damaged and cannot filtrate blood as well as they should. And because of this, excess fluid and waste from blood remains in the body, and it may cause health problems like heart diseases and stroke. It causes occurrence of infections, low calcium levels and high potassium levels with high phosphorus levels in blood. The next one is obstructive urinary syndrome. It can happen to people of any age, and it involves the level in the urinary tract from urethra to the renal pelvis. And these obstructions may be sudden or insidious, and it can be partial or complete. It can be bilateral or unilateral. And these can be congenital anomalies, and because of the urinary calculi, pregnancy, benign prostatic hyperplasia, scar tissues from infections and inflammations, tumors, neurologic disorders like spinal cord injury. And these can be classified according to the site, degree, and the duration of the obstruction. The third one is the three diseases included in the nephrotic syndrome. The first one is the minimal change disease. It is also called lipid nephrosis. It is characterized by the diffuse loss of the food process of the cells in the epithelial layer of the glomerular membrane. This can be seen commonly in children and rarely in adults. The cause of the minimal change disease is unknown, and it is not progressed to renal failure, but it can have significant complications like hyperlipidemia, protein malnutrition, and can be leading to some thromboembolic events. The second one is membranous glomerular nephritis. It is the most common cause for the primary nephrosis in adults. This is due to the caused by the diffuse thickening of the glomerular membrane due to the depositions of immune complexes. This disorder can be idiopathic and associated with a number of disorders like infectious diseases like chronic hepatitis B, autoimmune diseases like SLE, and the metabolic disorders like diabetes mellitus. And it is usually begins with the onset of nephrotic syndrome. The third one is the focal segmental glomerulosclerosis, and it can be characterized by sclerosis. It is particularly common cause for nephrotic syndrome, mostly in Hispanics and African Americans. Although focal segmental sclerosis often is an idiopathic syndrome, it is associated with reduced oxygen in the blood, HIV infection, and IV drug abuse. It can be occur as a secondary event reflecting glomerular scarring due to the other forms of glomerular nephritis. Okay, thank you so much.